Deep vein thrombosis, it's also important in AMC exam. Well, there are a lot of risk factors, but the most important risk factors include first, oral contraceptive pills and also hormone replacement therapy. Both of them will cause increase in estrogen hormone, and estrogen hormone has thrombogenic abilities, so it will lead to deep vein thrombosis. The second one is postpartum, especially the first 6 weeks. This is due to increase in estrogen throughout the pregnancy, and with delivery, the woman will walk less. So decreased walking with increase in estrogen will be the perfect risk factor for deep vein thrombosis. So it's very important. Also, antepartum will cause deep vein thrombosis, but it's less severe than postpartum. The third one is prior leg surgery, which is clear. And the fourth one is varicose vein, which due to stasis of blood inside the vein, it's clear. Finally, high BMI, more than 30. For the clinical picture, first of all, it will cause swelling, which is the keyword for deep vein thrombosis. It also will cause pain and tenderness, along with low-grade fever. Focus on this, low-grade fever. So the swelling is the most important part for me here in case of deep vein thrombosis. For the investigation will be duplex ultrasound. For the treatment, whenever you know that the patient suffering from deep vein thrombosis, you should start heparin and warfarin immediately at the same time. Heparin should be continued for at least 5 days, and warfarin should be continued at least 3 to 6 months. And your target INR will be between 2 to 3. Okay, so heparin and warfarin at the same time. Heparin for at least 5 days, and warfarin should be continued at least 3 to 6 months. And your target INR should be between 2 to 3. That's clear. Now we have 3 important differential diagnoses for the swelling of the calf area. The first one is deep vein thrombosis, the second one will be cellulitis, and the final one is hematoma. So how we can differentiate between them? For deep vein thrombosis, it will cause swelling, low-grade fever, and mild tenderness. So please focus on this. It will cause swelling, which is the keyword for us, and low-grade fever with mild tenderness, and also there is some congestion due to obstruction of the venous system. So this is the deep vein thrombosis. In case of cellulitis, the most important thing for you is high-grade fever and a huge redness. Here there is not congestion, there is an inflammation, so you will see a huge severe redness along with high-grade fever due to infection, with swelling. If you look at this picture here, you will see that this area is severe redness and there is high-grade fever in the patient along with the swelling. So this is cellulitis, and it's clear different than deep vein thrombosis. And final one is hematoma. For AMC exam, the hematoma will be clear by the history of warfarin use, and this patient presented with high NR and swelling at the calf area. So the case scenario will be talking about you have a patient using warfarin for maybe 2 to 3 or 5 months, I don't care, and he presented to you with a calf swelling and her or his INR is high. This represents hematoma straightforward. So deep vein thrombosis will cause low-grade fever along with mild congestion, while cellulitis will cause high-grade fever along with severe redness. And the final one is hematoma. It's just a swelling with high NR and history of using or any other anticoagulant. That's all related to deep vein thrombosis for AMC exam. For full course, please contact us through amcqbook@gmail.com, and please don't forget to like, subscribe to the channel. Thanks and goodbye.